All right, now we're gonna show you how to process a tray from a procedure. So we're gonna come into the sterilization room. We're gonna hand hygiene. Just gonna rub all that in. Make sure you rub that in good before you try to put your gloves on. You're gonna select your gloves here. Now the tray we're using is a little bit different. It has more instruments on it and it has a handpiece. So this would be a tray from maybe a filling procedure, endodontic procedure, crown prep. So she's putting her gloves on, and then we're gonna put these utility gloves on. And remember, you need to wear utility gloves whenever you're processing instruments. So she's gonna get those on. Our tray is gonna be up here in this rack that she's gonna grab. And then we also have eyewear up here, and we'll talk about that. There should always be a pair of eyewear here because you're gonna leave yours here when you're done with this procedure. All right, she's gonna grab her tray down. We're gonna get rid of the 2x2s, the cotton products, the patient napkin, and then we're gonna get rid of the HVE, the saliva ejector, and the air water. Those are all disposable items, so those go in the trash. Next, we're gonna take the handpiece and put it up here because we do not want hand pieces going in this ultrasonic. No hand pieces. Now she's gonna lift the lid, lift up the basket. We're gonna roll these instruments into the basket. You wanna try to handle the instruments the least amount possible. Okay, she's gonna put the basket down, shut the lid, and then we're gonna push start. Now we're gonna handle the tray. So she's gonna pick up the tray, make sure there's no tears in the barrier. If there's no tears in the barrier, then she can just shimmy it down without touching the tray. Yep, shimmy it down, drop it on the clean side without touching anything, and then the barrier goes in the trash. Now she's gonna take the handpiece and we're gonna wipe it with a 2x2 with alcohol. So basically we're just removing debris. The same thing that is happening to the instruments in the ultrasonic, we're doing it manually with the alcohol and 2x2 to make sure there's no debris. And then we're coming over. And this machine is our machine that is going to clean and oil our hand pieces. So she's going to pull it open. We're going to just slide it right on this little tube here. Push up and pull down and make sure it's on. Perfect. Close up the machine. We'll push start. Perfect. Now while she's waiting, she's going to grab her sterilization bag. So she's going to grab two. We need one for the instrument, one for the handpiece. On these bags, we're going to put our initials. And then we are going to stamp it with the sterilizer that we're using. So we have this sterilizer that is the happy face. So she's gonna stamp the happy face. If you have more than one sterilizer, then you have to have 2 different stamps for that. Okay, so now our handpiece is done. We're gonna open that up. Pull the handpiece out. Pull down, good. Now we're gonna kind of wipe it off. We can wipe it off with a paper towel or we can wipe it off on our towel that we have. It just might have some oil all over it from being in that machine. Perfect. And then she's gonna go ahead and bag that. Slide it in the bag. She's pre-folding that bag, which is nice to do before you try to tear off that sticky part because it's kind of hard to do with these big old gloves on. And then she's sealing right on the preparation and then it goes in the basket. Now our ultrasonic, it's gonna be done. There wasn't much debris on there, so we can go ahead and stop that. We're gonna lift the lid, take out the entire basket, let some of that chemical come off of there, and then we're gonna rinse it. You always wanna rinse off when it comes out of that ultrasonic to make sure there's none of that enzymatic solution on there. Now she's gonna roll it onto the towel. You wanna make sure that you roll it kind of away from you or sideways. You don't wanna roll it towards you because even though you have the gown on, it can get on your shoes and the bottom of your scrubs. Now we're gonna put that back in and then close that ultrasonic. We wanna keep that closed all the time. That is the most contaminated place in the whole office. Now we're gonna pat dry. So this time we're gonna use a paper towel. Gonna pat dry her instruments. And then we're gonna bag them. She already has her bag ready. She's gonna pre-fold, put her instruments in, So now you want to make sure when you're loading those that they don't come out the bottom. If they come out the bottom, you have to get a new bag. So if you see, she kind of has her bag laying flat, not holding it straight up and down, because they will go out the bottom part of that bag. I'm going to load all those up. And she's going to fold that over right on the preparation. Got to make sure that it's sealed up so that it stays sterile when it comes out of the sterilizer. All right, we're going to place here. All right, so there's quite a few in this area here. Let's go ahead and load them. So if we come over, the door is closed, so she has a couple options of what she can do. She can't touch it because it says clean hands only. So if somebody else is in the room for her, they could open it for her, or she could get a paper towel as a barrier to open the door. All right, now we're gonna pull out trays, and she's gonna load. So this is going to be paper side down. Now when you load, you don't want to have the instruments overlapping. You can have some of the packaging overlapping, but not the instruments. Perfect. And she pulls out the next tray. Perfect. So now these are the x-ray holders. Remember those XCPs? Those cannot go on the bottom tray. It gets too hot down there and it will melt them. We'll put the other one in. Perfect. And the last one on the bottom. Okay, so she can slide those in, but she can't close the door because it's clean hands only. So now we're coming back over. We still have a pair of goggles up here that we need to process. So she's gonna grab the eyewear. She's gonna rinse. We're removing debris off of there, rinse. And then she's gonna dry. She can either use that towel or she can get a paper towel, whatever is easier. Get them dry. And so that's the cleaning step. Now we need to disinfect them. So she's going to grab 2 wipes. So the 2 wipes, because she's going to hold with one and wipe with the other, because remember your purple gloves are really dirty, really contaminated, because we've been using them in this sterilization area. So you don't want the purple to touch anywhere on the glasses. So she's just wiping to get that chemical. And then she's gonna turn around, drop them on the clean side. Now we can use those wipes to just wipe off our utility gloves. Even though they stay in the sterilization area, it's nice to wipe them off. We want the least amount of contaminants as possible. So she's gonna wipe those off with those wipes. Then she's gonna remove those, hang them back up on the hook. Oh, perfect. And then she's going to remove her exam gloves now. Remove her gloves, pulling off, using the other one to take off that other glove. Perfect. And then we're going to hand hygiene. Hand hygiene. Now she has her eyewear on that are going to need to be processed. So she's going to tip those glasses from behind. Grab them from way back behind, and she's going to drop them on this eyewear tray. So the next person that comes in will take care of her eyewear. And then we're gonna come over. Now she has clean hands, so now she can start the sterilizer. First thing we wanna do is check and make sure that the water level is in the green. It can't be in the red. There's not enough water for it to do what it needs to do. So make sure that's always in the green. Okay, she's gonna close the door, push in and pull down on the handle. Then we're gonna click pouches and start. There we go. That's your processing of an instrument with instrument tray with a handpiece, and then loading and starting your sterilizer.